Welcome to Module 8 of our education program. Last session, I discussed the connection between nutrition and childhood disorders. I went over that nutrition is important. Not only does it help your child's brain and body develop to their optimal potential, but it enables your child to live a healthy life, maximizing energy and minimizing illness. I also went over aspects of nutritional problems. I went over that all nutritional problems fall into one of two categories. Either something is bothering the body or something is missing. So either the child is reacting to something they are eating or they are not getting enough of something. It's important to consult your doctor if your child is having feeding problems that may be due to nutrition. Nutrition can also play a component in many diagnoses and disorders, and I went over Gerd and celiac disease. So GERD, also known as gastroesophageal reflux disease, is when food and acid from the stomach go back up into the esophagus, causing your child to spit up and throw up. And GERD causes problems such as poor growth, vomiting, damage to the esophagus, pain and irritation in the nose and mouth, along with other symptoms such as chronic coughing or feeding problems. And then I discussed how celiac disease is an autoimmune disorder, and it happens when a child has a food intolerance to gluten and the body can't absorb important nutrients. This session, I'm going to talk about how to form healthy eating habits with your child. So by the end of my presentation, I hope you will understand the importance of healthy eating habits. I hope you'll be able to list foods to encourage from 6 months and on. And you'll also be able to list foods to avoid in the first year. And then you should be able to describe nutritional and lifestyle factors to consider with children with autism. So what is healthy eating? Healthy eating means eating a variety of foods so that your child gets the nutrients such as proteins, carbohydrates, fats, vitamins, and minerals that he or she needs for normal growth. If your child regularly eats a wide variety of these foods, he or she will be well nourished, and that is the ultimate goal when it comes to nutrition. So how much food is good for your child? With babies and toddlers, you can usually leave it to them to eat the right amount of food at each meal, as long as you make only healthy food available. Babies cry to let us know they're hungry, and when they're full, they'll stop eating. Things get more complicated at age 2 or 3, when children begin to prefer the taste of certain foods and dislike the taste of other foods, and have a lot of variation in how hungry they are. But even then, it usually works best to make only healthy foods available and let your child decide how much to eat. It may worry you to see your child eat a very little at meals. Children tend to eat the same number of calories every day or two if they are allowed to decide how much to eat. But the pattern of calorie intake may vary from day to day. One day, a child may eat a big breakfast, a big lunch, and hardly any dinner. And the next day, this same child may eat very little at breakfast, but eat a lot at lunch and dinner. Don't expect your child to eat the same amount of food at every meal and snack each day. How can you help your child eat well and be healthy? Many parents worry that their child is either eating too little or too much. Perhaps your child only wants to eat one type of food. Maybe it's peanut butter and jelly sandwiches. One way to help your child eat well and help you worry less is to know what your job is and what your child's job is when it comes to eating. If your child only wants to eat one type of food, he or she is doing the parent's job of deciding what the food choices are. It is the parent's job to decide what foods are offered. Your job as the parent is to offer nutritious food choices at meal times and snack times. You decide the what, where, and when of eating. Your child's job is to choose how much he or she will eat of the foods you serve. Your child decides how much or even whether to eat. If this idea is new to you, it may take a little time for both you and your child to adjust. In time, your child will learn that he or she will be allowed to eat as little or as much as he or she wants at each meal and snack. This will encourage your child to continue to trust his or her internal hunger cues. Here are some ways you can help support your child's healthy eating habits. First, you can eat together as a family as often as possible. Keep family meals pleasant and positive. Avoid making comments about the amount or type of food your child eats. Pressure to eat actually reduces children's acceptance of new or different foods. Second, you can make healthy food choices for your family's meals. Children notice the choices you make and follow your example. Third, make mealtimes fairly predictable. Eat at around the same times every day and always at the table, even for snacks. Fourth, have meals often, for example, about every 3 hours for toddlers, so that your child doesn't get too hungry. 5. Do nothing else during the meal other than talking and enjoying each other. No TV or other distractions. 6. Take your child to all recommended well-child checkups. You can use this time to discuss with a doctor your child's growth rate and eating habits. You can also discuss eating habits with an occupational therapist as well. So why is it important to form healthy eating habits with your child early? Because it develops a foundation for lifelong healthy eating, and it also reduces conflict relating to eating. Healthy eating patterns your child starts early will help promote healthy habits in the future. It is important to provide foods that match your child's eating skills. At first, foods may need to be soft and mashed or bite-sized. On this slide are some foods to encourage your child to eat from 6 months and on. Offer your child a variety of fruits, vegetables, whole grains, meats, and yogurt or cheeses. Make a rainbow of different colored foods on your child's plate. Here are a few examples. For fruits, you can offer bananas, strawberries, pears, oranges, melons, and avocado. For vegetables, you can offer cooked spinach, carrots, peas, sweet potatoes, and beets. For whole grains, you can offer whole grain bread, crackers, or pasta. For meats, you can offer soft and small pieces of beef, lamb, chicken, fish, and turkey. For dairy, you can offer pasteurized yogurts or cheeses. And once your child is 12 months old, he or she may be eating more of the foods that you eat. Eating a healthy diet sets a good example for your toddler. Continue to offer a variety of healthy options and allow your child to choose foods to eat. I also have on this slide some drinks to encourage your child to drink from 6 months and on. When your child is between 6 and 12 months old, you can offer them water, so 4 to 6 ounces per day, or breast milk if you are still breastfeeding, or infant formula. Once your child is 12 months old, you can begin offering fortified cow's milk. Healthy eating is all about balance. There is no need to add salt or sugar to your toddler's food. There are also some foods and drinks that are not safe for your child to eat, and others that are not as healthy choices as other foods. For example, honey before 12 months may cause a serious type of food poisoning. Before your child is 12 months old, do not give him or her any foods containing honey, including yogurt with honey and cereals and crackers with honey, such as honey graham crackers. Unpasteurized drinks or foods, such as juices, milks, yogurt, or cheeses, may put your child at risk for harmful bacteria that can cause severe diarrhea. Do not give your child unpasteurized drinks or foods, as I listed above. You also want to avoid foods with added sugars. Low-calorie sweeteners or no-calorie sweeteners are not recommended. Foods with added sugars can include muffins, flavored yogurts, or cookies. Children younger than 24 months old should avoid added sugars. Sugar-sweetened drinks, such as soda, pop, soft drinks, flavored milks, sports drinks, flavored water with sugar, and juice drinks that contain added sugars should also be avoided. These drinks are different than 100% juice. Children younger than 24 months old should avoid added sugars. You should also avoid foods that are high in salt or sodium, such as some canned foods, processed meats, such as lunch meats, sausages, hot dogs, and ham, and frozen dinners should be avoided. Some snack foods and store-bought packaged toddler foods are also high in salt, just to, just to be aware of that. You should also avoid cow's milk before 12 months old because this may put your baby at risk for intestinal bleeding. It also has too many proteins and minerals for your baby's kidneys to handle easily and does not have the right amount of nutrients your baby needs. You should avoid juice before 12 months old. It is not recommended. Children should not drink any fruit or vegetable juice before they are 12 months old. Juice after 12 months old is not necessary, but 4 ounces or less of 100% juice a day can be provided. Check nutrition fact labels to make sure it is 100% juice. Juice drinks, fruit drinks, and fruit-flavored drinks have added sugars and should be avoided. Whole fruits are healthier options for your child than fruit juices. Lastly, avoid caffeinated drinks such as soft drinks, tea, coffee, and sports drinks. These should be avoided for children younger than age 2. There is no established safe limit for caffeine for young children. Again, on this slide are just examples of foods and drinks and do not include all possible foods and drinks to avoid or limit. Talk with your child's doctor if you have more questions about which foods to avoid or limit. Linked below is this video that contains the foods and drinks to avoid and limit giving your child. It's a little review of what I just discussed and has a few more examples. So now I want to move on into how monitoring nutrition is so important for kiddos with autism. Many kids with autism have food aversions and sensitivities. Many also have behavioral issues that make mealtime particularly challenging. And for good reason, parents and other caregivers worry about providing their children with healthy diets. Children with ASD, also known as autism spectrum disorder, are 5 times more likely to have mealtime challenges such as tantrums, extreme food selectivity, and ritualistic eating behaviors. Inadequate nutrition is also more common among children with autism than it is in those unaffected by the disorder. In particular, they have an overall low intake of calcium and protein. Calcium is crucial for building strong bones, and adequate protein is important for growth, mental development, and health. Chronic eating problems also increase a child's risk for social difficulties and poor academic achievement. This may also increase risk for diet-related diseases such as obesity, cardiovascular disease, in adolescence and adulthood. Many parents report that their children's autism symptoms and related medical issues improve when they remove casein, which is a milk protein, and gluten, which is a wheat protein, from their diets. However, casein and gluten-free diets can increase the challenge of ensuring adequate nutrition as well. Nutrition and lifestyle interventions are shown to be beneficial for those with autism. So there is growing evidence that nutrition and lifestyle interventions can be very supportive to children with autism. For example, many children and adolescents have severely disrupted digestion, so restoring balance in the gut is a key focus from a nutritional perspective. The following are also important nutritional and lifestyle factors to consider. One is to improve digestion, again by restoring that balance in the gut. Another important factor to consider is balancing blood sugar. For autistic children who show signs of hyperactivity, improving blood sugar balance is an important consideration. Dietary studies found that hyperactive children are less able to handle sugar intake and maintain balanced blood sugar levels. If a child is regularly snacking on refined carbohydrates, sweets, chocolate, fizzy drinks, juices, and have little or no fiber, protein, monounsaturated and polyunsaturated fats to slow the glucose absorption, the levels of glucose in their blood will seesaw continuously. This may cause fluctuations in their levels of activity, concentration, focus, and behavior, and have an impact on their brain function and development. It's important to cut out those sugars and refined sugars from their diet. Have the child eat unrefined carbohydrates such as fresh vegetables and fruit, and ensure these are combined with protein and monounsaturated and polyunsaturated fats to further slow the sugar release. Another nutritional factor to consider is increase in omega-3 fats in the child's diet. Deficiencies in essential fats are common in people with autism. Research has shown that some autistic children have an enzymatic defect that removes essential fats from the brain cell membranes more quickly than it should. This means that autistic individuals are likely to need a higher intake of essential fats. It has been found that supplementing EPA, which can slow the activity of the defective enzyme, has clinically improved behavior, mood, imagination, spontaneous speech, sleep patterns, and focus in autistic children. There have since been clinical trials testing omega-3 supplementation, which have found that when children with autism were given omega-3 supplements, improvements in symptoms such as hyperactivity, social ability, concentration, irritability, and aggression were reported. Another way to increase those omega-3 fats is to provide oily fish or a supplement through fish oil or flaxseed. Another lifestyle factor to consider is to increase vitamins and minerals. Research shows that vitamin B6, C, and magnesium supplements sufficiently improve symptoms in autistic children. Vitamin A is essential for vision. Vitamin D has been shown to improve symptoms such as attention span, eye contact, and behavior. It's also important to exclude those food additives. You can also identify food allergies such as gluten and dairy. Undesirable foods and chemicals reach the brain via the bloodstream because of faulty digestion and absorption. The strongest direct evidence of foods linked to autism involves wheat and dairy. Specific proteins contain gluten and casein. These are difficult to digest. If you decide to go the route of attempting to remove these foods from your child's diet, you'll need to take a slow approach. It is recommended that you gradually withdraw foods, waiting 3 weeks after removal of dairy foods, which is casein, before removing the wheat, barley, and rye, which is gluten, from the diet. Initially, your child may go through withdrawal, and their symptoms may get worse for a bit. But keep a food diary and note your child's behaviors and symptoms alongside all the foods they're eating. This can help identify which foods they are sensitive to. Many major changes in the diet should be supervised by a pediatrician, nutritionist, occupational therapist, or other professional. It's also important to address nutrient deficiencies in children with autism, as well as ensuring an optimal intake of essential fats, most notably those omega-3 fatty acids. So how do you improve digestion in autistic children? Research has identified a possible link between the imbalances in the composition of microbiota in the gut of children with autism. This may be linked to symptoms such as irritability and decreased ability to concentrate, caused by discomfort as a result of digestive issues, such as constipation and/or diarrhea. Many parents of children with autism report that their child has received repeated or prolonged courses of antibiotic drugs for ear or other respiratory infections during their first year before the diagnosis of autism. Broad-spectrum antibiotics kill good as well as bad bacteria in the gut, and this may be why autistic children commonly have bowel irregularities. Restoring a healthy gut is vital. You can start simply under the supervision of a doctor by supplementing digestive enzymes and giving probiotics to restore the balance of the gut bacteria. Both measures may help to restore balance to the digestive tract and promote normal absorption. So I just want you to keep in mind that any nutritional changes that you make in your child's diet, it's important to run by a pediatrician, your occupational therapist, a nutritionist, or another professional before making those major changes to your child's diet. So a knowledge check question for you. Select all that apply. Why is it important to form healthy eating habits with your child early? Is it A, it develops a foundation for lifelong healthy eating? B, it reduces conflict relating to eating? Or C, it allows them to choose and eat whatever foods they want? The answer is A and B. So why is it important to form healthy eating habits early with your child? Because healthy eating habits early develop a foundation for lifelong healthy eating and reduce conflict relating to eating. Another knowledge check question for you. Select all that apply. What are foods to avoid before your child turns 1? A, honey. B, fruit juice without added sugar. C, cow's milk. D, homemade green beans. E, homemade carrots. Or F, products with peanuts. So foods to avoid before your child turns 1 includes A, honey. B, fruit juice, even without added sugar. C, cow's milk, and F, products with peanuts. Products with peanuts can be a choking hazard. Some resources for you that I'll link below include the Managing Symptoms of Autism handout, and this has some nutritional facts as well. And then another handout titled Tips for Picky Eaters with Autism.
For this module, I will be discussing coping with maternal mental health. So what exactly is coping? So it can be defined as a cognitive and behavioral effort of dealing with a situation that is thought to be stressful. So there are many different types of coping, and this is not an all-inclusive list, but I tried to break it up into 3 different areas. So we have problem-focused coping, emotion-focused coping, and dysfunctional or avoidance. Problem-focused coping can be thought of as dealing with the source directly. Emotion-focused can be thought of as attempting to manage thoughts and feelings. And then dysfunctional or avoidance coping can be just avoidance of the problem or the feelings in general. So problem-focused and emotion-focused coping can be used in a positive or a negative way. So for example, you might try to manage your symptoms by venting to a friend, but when you're venting to your friend, you are focusing on the negative. So there can be good ways of expressing emotion and bad ways of expressing emotion. So it can just be thought of differently in the light that you see it in. So why is learning about coping skills important? So a study shows that women who cannot identify the cause of their postpartum mental health are more likely to use all 3 forms of those type of coping strategies negatively. Individuals that don't know the cause are more likely to use ineffective coping skills. And of course, knowledge about coping and depression can increase problem-focused coping, which would be a positive coping manner, and lessen and improve symptoms. So I want to discuss some unhealthy coping strategies that people may use. The first one we have is avoidant, like I've discussed before. And avoidant coping can be thought of as using denial, distancing yourself from others, maybe blaming yourself for others, and of course substance or alcohol use. And a study shows that this coping style during the 3rd trimester of pregnancy can lead to higher depressive symptoms at 6 weeks postpartum. Next, for some unhealthy coping strategies, we have disconnection. So that can be thought of as distraction or distracting yourself from what you're feeling, venting in a negative manner, behavioral disengagement, self-blame, and denial of symptoms. And a study shows that mothers who engage in this type of coping are shown to perceive motherhood more as a stressful event that cannot be avoided. It is also shown to increase postpartum depressive symptoms. And other types of unhealthy coping can include drinking or smoking, maybe hitting or throwing, talking badly about yourself or others, or even compulsively shopping. So does coping styles have an effect on our children? And the answer is yes. So we know coping is related to the ability to be able to self-regulate. That can be for children and adults. And of course in adults, if there are failure to cope, that can lead to the continuance of mental health symptoms or episodes and increase the severity. And coping can cause a weak attachment to the fetus, and that is negative coping. And that can be during pregnancy or even with the child after childbirth. So now that we've discussed some unhealthy coping strategies, I wanted to talk about some healthy coping strategies. And the first one we have here is meaning making. So that can be thought of as using postpartum depression or mental health symptoms as an opportunity for growth. So that could be pulling yourself out of a dark place, and this would cause you to discover new things about yourself. You may discover new strengths, or maybe even like your weaknesses, and just becoming more self-aware. Accepting the reality of motherhood. This could be accepting that your perception of what motherhood was supposed to be may not be the reality, and recognizing that you may not know the reason, maybe for every cry, or maybe dinner isn't made on time each day. And just accepting this might actually make you feel less pressure. And then connecting with your spiritual beliefs. So for some people, this might be prayer, or more so maybe just putting your faith into something bigger than yourself. This could maybe help you find more peace with your symptoms or your diagnosis. So moving on with some healthy coping strategies, the next one I have here is seeking support and connections. So this could be finding a middle ground for you and your partner, or putting each other in charge of specific chores and responsibilities. This might also include reaching out to family and friends for support. The next one we have is accessing services. So this could be maybe finding a good nurse or a therapist. It could also include reaching out to local community programs if maybe you're having trouble financially. A lot of these places are more than happy to help you find free resources and give you supplies if you're in need. And these resources are out there to help people in need. So don't be afraid to reach out to them if you are needing support. The next one I have is connecting with other families. So like I've said many times, this is the peer support coming into play. So finding other parents or mothers who are in similar situations could be great for your mental health and just relation of lives and information, and maybe just finding support in other people. So moving on with more healthy coping strategies, I have nurturing oneself. So I like to think of this as self-care, or finding your interests and hobbies. Taking extra care of yourself and extra time to make yourself feel more than just like a mother. Maybe finding recreational activities, finding a sport or activity that you enjoy. This can be solo or with other friends. And I always say finding something outside is amazing because we know how great vitamin D can be for depressive symptoms. Next one is positive outlook. So this is trying to think of the positive aspects of your life rather than the bad. So maybe you had a terrible day and your kids were crying and you and your spouse were arguing. Taking maybe just a step back to think, yes, my kids have been in a horrible mood today, and that puts stress on us as parents, but they have full bellies and a warm place to sleep tonight, so I think we did a pretty good job. I had a mom tell me once that sometimes it's just about getting through the day when you're a parent, and that is okay sometimes. Every day isn't going to be sunshine and rainbows, especially for those suffering with maternal mental health symptoms. Having a positive outlook can be better said than done, but if you are having trouble with this, this can be when talking to a therapist could be very beneficial. So the next one I have here for a healthy coping strategy is raising awareness. So I think this strategy is a great one. Providing support to others and raising awareness is always beneficial. This goes along with decreasing stigma that postpartum depression shouldn't be talked about. A lot of women go through difficult times with mental health, and if you know of any other mothers, I think it would be a great idea to tell them that you are there for support. This could help both parties. Being able to discuss some similar situations that you may have been through or thoughts you may have could be very helpful for yourself and them. Other healthy coping mechanisms include writing in a journal, going for a walk, connecting with your spirituality, and of course, talking to others. So if we know we're about to go through a life-altering event such as motherhood, is there a way to prevent the severity of symptoms or a way to prepare for coping? I'll talk about that in this module. So instead of prevention, I would like to change the word to preparation. There's no known way to prevent mental health from occurring, but there are ways we can prepare. It's hard to tell if what will work for one person will work for someone else, so that is why I like to change it from prevention to preparation. A lot of what we've already been learning about throughout this program can be thought of as preparation if you're lucky enough to be able to prepare. So what are some areas in which we can prepare? I found a study regarding a program made just for expecting moms, and some of these moms already have children as well, so this can be applied for already seasoned mothers or new mothers. In this study, they liked to educate mothers on having pleasant thoughts or more positive thinking. They like to find activities that the mothers enjoyed or previously enjoyed. They also like to analyze the contact that they had with other people. And they also liked to educate mothers on how moods can affect bonding with your baby. So as we know, knowledge is key. So educating yourself on all of these different areas could help you be more prepared for a life-altering event such as motherhood. So in the study I just discussed, they also talked about self-improvement and coping skills. Within that, they liked to have the mothers evaluate their feelings daily, be more aware of how they're feeling. They also like to practice having the mothers ask for help. There are some people out there that do not like to accept help from others, but this is something that they like to prepare people on and have them work on because help can actually be very, very beneficial for new moms. They also like to discuss and educate mothers on scheduling a specific time for having negative thoughts and feelings. And dependent on each mother's situation, this could be multiple times a day, once a day, or even maybe once a week. But rather than having these thoughts consume their entire day, they like to schedule maybe an hour or 30 minutes within the mother's day where she can go off and be alone and have time to think of those negative thoughts and feelings. So maybe you realize that your coping strategies need some work, or maybe you don't have really a good set of coping skills. So how can we develop some coping skills? Well, first we need to identify coping skills that maybe worked for us in the past, or even just think about things we typically enjoy. So maybe think about 1 to 3 things that you enjoy, and if you're having trouble identifying them, maybe ask your spouse or loved ones for support. Second, we develop a plan for that coping skill. What time of the day will you use it? What negative feelings will trigger you to want to engage in this skill? And remind yourself that utilizing this skill is going to be just as important as daily chores. So schedule that coping skill in with your daily routine. And third will be simply practicing that skill daily. So even before you think you'll need to utilize that coping skill, start practicing that skill now. So some final thoughts I have for this module is knowledge is power. So just being aware of how to develop coping skills and what might happen during your postpartum experience, or maybe even just educating yourself on the symptoms, is very helpful. Nourish and take care of your body. So make sure to take time to really take care of yourself and eat healthy foods and exercise. As cliche as it may sound, it is really important to make sure not just your mental health is good, but your physical health as well. Don't stop doing things that you enjoy. It is hard in motherhood to schedule time for yourself, but it is very important for your mental health and beneficial to keep doing the things that you thoroughly enjoy. And of course, seek out help from others or professional if needed. Peer support and just general social support is very great, and therapists are really good at helping pave the way to helping you relieve some of those mental health symptoms. So as far as resources here, I found a website called positivepsychology.com. And on there, they do have coping skills worksheets, which I think is really a different and fun way for some information and actually a coping skill. So even for kids, they have different age groups on that website, and they have free worksheets for different coping strategies, helping you identify them, different worksheets on stress and anxiety, emotions, and also trauma. So a knowledge check here to end this module. Using this as a coping strategy during the third trimester of pregnancy can lead to higher depressive symptoms at 6 weeks postpartum. A, exercise, B, denial, C, distancing, D, A and B, or E, B and C. The answer is B and C, denial and distancing. Using these as a coping strategy during the third trimester of pregnancy can lead to higher depressive symptoms at 6 weeks postpartum.